Farm infections. Tinea corporis is characterized by plaques with scaling and erythema, most pronounced at the periphery. A few small vesicles and pustules may be seen within them. The lesions expand slowly and healing in the center leaves like typical ring-like pattern. Tinea of groin is cruris. The eruption is sometimes unilateral or asymmetrical, and upper inner thigh is inward, and lesions expand slowly to form sharply demarcated plaques with peripheral scaling. In contrast to candidiasis of groin area, the scrotum is usually spared. A few vesicles or pustules may be seen within the lesions. Tinea pedis is the most common fungal infection in humans. Sharing of vast places, showers, and swimming pools predisposes to infection. Occlusive footwear encourages the relapse. Scaling type, scaly skin is between the toes we have to notice, and Mocasian type usually affects bottom of feet. Red, scaly or thickened skin will be seen, and vesiculobullous lesion affects sole and skin between toes. Fluid-filled bumps will be seen, and ulcerative lesion is uncommon. Ulcers or open sores will be seen. Toenail infection is usually associated with tinea pedis, and the initial changes occur at the free edge of the nail, which becomes yellow and crumbly. Subungual hyperkeratosis and separation of nail from its bed, and thickening may then follow. Usually, only a few nails are infected, but rarely all are infected. Fingernail lesions are also similar to toenail infections. Tinea of hand is usually asymmetrical and associated with tinea pedis. Tinea rubrum, Trichophyta rubrum may cause a barely perceptible erythema of one palm with characteristic powdery scales in the creases. Tinea capitis is scalp infection. This is usually a disease of children. Causative organism varies from country to country. Fungi coming from animal sources, zoophilic fungi, induce a more intense inflammation than those spread from person to person, anthrophilic fungi. In ringworm acquired from cattle, for example, the boggy swelling with inflammation and pustulation lymphadenopathy is often so fierce that a bacterial infection is suspected. Such a lesion is called kerion, and the hair loss associated with it may be permanent. Tinea of the beard is usually caused by zoophilic species and shows the same features. Anthrophilic organisms cause bald rather than scaly areas with minimal inflammation and hairs broken off 3 to 4 mm from the scalp. In favors caused by Trichophyta and Schonlini, the picture is dominated by foul-smelling yellowish crust surrounding many scalp hairs and sometimes leading to scarring alopecia. Treatment include local ointment preparations needed for minor skin infections. Most recent imidazole preparations, miconazole, clotrimazole, and alamines like terbinafine are given, and avoid steroid-containing ointments. Systemic treatment is needed for tinea of scalp or nails and for widespread or chronic infections of the skin that have not responded to local measures. Itraconazole as a single week-long pulse of 200 milligram daily is effective in tinea corporis. Terbinafine cure rate of 70 to 90% can be expected for infected fingernails after 6 weeks course of terbinafine, and for infected toenails for a 3-month course. Toenails 3 months course, fingernails 6 weeks course. And it is not effective in pityriasis or candidal infection. Terbinafine has replaced griseofulvin, and it is first choice antifungal. Unlike itraconazole and fluconazole, its action doesn't involve cytochrome P450 dependent enzymes in the liver. Dose is 250 milligrams, and it is fungicidal. Tinea pedis 2 to 6 weeks treatment, carpor is 4 weeks, and anguvum 12 weeks. Side effects include gut upset, headache, and rashes, including toxic epidermal necrolysis, stage disturbance, rarely liver toxicity. Plasma concentration of terbinafine reduced by rifampicin, and plasma concentration increased by cimetidine. Avoiding hepatic and renal impairment when breastfeeding, and not to use in pregnancy, and not to recommend in children. Itraconazole is now preferred to ketoconazole, which occasionally damages the liver and is reasonable alternative to terbinafine and griseofulvin if these are contraindicated. It is effective in tinea corporis, cruris, and pedis, and also in nail infections. It is fungistatic rather than fungicidal, and it interferes with P450 system. So, a review of any other kind of medication being taken needed before a prescription is issued. Its wide spectrum makes it useful also in pityriasis versicolor and candidiasis. For candidal infection, vulvovaginal candidiasis 200 mg twice daily for 1 day and oropharyngeal 100 mg daily for 15 days. Next, pityriasis versicolor 200 mg daily for 7 days. Dermatophyte infections 100 mg daily and tinea pedis and manum for 30 days, corporis for 15 days. Tinea of nails, intermittent regimen can be used 200 mg twice daily for 1 week per month, continued for 3 to 4 cycles. This is pulse regimen. Tinea of nails, pulse regimen. Side effects include gut upset, headache, and antacids reduce the absorption, and rifampicin and phenytoin reduce the plasma concentration. Many may potentiate the effects of warfarin and may increase plasma levels of digoxin and cyclosporin and inhibits the metabolism of acetymazole. This may lead to serious dysrhythmia. It should be avoided in hepatic impairment, avoiding children, pregnancy, and when breastfeeding. What are the differential diagnosis of dermatophytes infections? Various include psoriasis and dermatitis, atopic, nummular, or contact dermatitis, alopecia areata in case of tinea capitis, seborrheic dermatitis, and psoriasis, and tinea faciae, rosacea, lupus, acne vulgaris, and tinea pedis dermatitis, contact also erythrasma if it is interdigital. Duration of treatment for tinea capitis is with itraconazole 100 mg to 200 mg once daily for 4 weeks, fluconazole 50 mg once daily alternatively, followed by 150 mg once a week for 4 to 8 weeks. Terbinafine 250 mg 4 to 6 weeks. Tinea corporis 2 to 3 weeks of terbinafine, OD 250 mg or itraconazole 200 mg per day, 1 to 2 weeks. Tinea pedis, terbinafine 250 mg 1 week. If it is interdigital type, occasion type 2 weeks. And itraconazole 100 to 200 mg per day for 2 to 4 weeks. Fluconazole 150 mg per week for 4 weeks in case of tinea pedis. Thank you.
Long live those who love. Hate blurs your view. Hate gives you energy, but takes your control. Hate will distract you from your mission, Grim. Hate is an instrument of the puppet state to distract you. Hate narrows your vision so that you don't see what's going on in the background. If you want to rule the street, you need 99% love and 1% violence.